This is the first of a number of short videos where we will look at infection control, or what some people call infection prevention and control. As usual, we will always begin by locating this material in our subject intended learning outcomes. So these are the six intended learning outcomes for this subject, which you're all familiar with now. I want you just to spend a moment, so just push the pause button on the video, looking at these intended learning outcomes. Where do you think infection control or the prevention of infection in a clinical setting would sit against any of these? Pause. Well, you probably all would have got this one. Number 2, explain appropriate infection control procedures, because Blind Freddy could see that. But it's also sitting up here, it's related also to our legal obligations. So what we do to protect the public from infection in a healthcare setting is also governed by rules and regulations, because there can be very serious outcomes if people are infected as a result of the dental treatment we're providing them. So it sits also with intended learning outcome 1. And the other area it sits with is intended learning outcome 4, where we are interested in the medical and dental history of our patients, and why knowing about the history related to their medical and dental care or experience is important. So here we will identify things that may place others at risk. So if the patient is carrying an infection which could place others at risk, or if they themselves have a condition which makes them susceptible, so if they're immune compromised, for example, then they may be more at risk of becoming ill through exposure to infectious agents that otherwise, normal healthy people wouldn't be compromised by. So these are the 3 intended learning outcomes where this material sits. For this particular session or week where we look at infection control, there are a number of guiding intended learning outcomes. So at this level, these are the things that we need to be able to do, say, and value. The first is to describe what is called the chain of infection and identify examples of infection control and prevention strategies at each of the stages in the chain, or each of the links in the chain. And we use the metaphor of the chain of infection deliberately, because if you break, like a chain, if you break one of the links or a number of the links, then the chain no longer has any strength. So if you put in strategies in place to break the links in the chain of infection, then the likelihood of transmission of infection becomes less. So you'll need to describe that chain of infection and then identify examples of where you might put strategies in place. The second thing you need to be able to do is compare and contrast standard precautions, which we'll talk about, and transmission-based precautions. So in infection control and prevention, there are 2 general approaches to precaution. One is the standard, which we apply to everybody, and then there are some special cases in which we may use additional precautions, but they are special cases and they are very specific, and we'll talk about those in detail as well. You also need to identify and describe the elements of standard precautions. So once you've compared and contrasted, so said what is different and what is the same between standard precautions and transmission-based precautions, you're then asked to identify and describe the elements of the standard precaution. Then you will explain appropriate infection control procedures. So you'll be able to tell us what procedures can be put in place in a dental care setting. And then you'll have to do that. So you have to describe or explain why we do particular things, when we do particular things, and how we do particular things. And then you'll have to show us that you're able to do that in a simulated dental clinical setting. So in our dental clinic, Lab D, you'll be asked to demonstrate your understanding through doing. So it's always a good idea to begin with some clear definitions of what we mean by these terms that we're using. So I've taken the Australian Dental Association's definition of infection control, and they say that the purpose of infection control in the dental practice is to prevent the transmission of disease-producing agents, and they can be things like bacteria, viruses, fungi. There are some other nasty organisms, prions, that sort of don't fit into those families very well. We're still learning about those things. So it's the prevention of transmission of these agents from one patient to another, from dental practitioner to dental staff, from patients to dental practitioners or to other staff. So you can see that there are multiple interactions that occur in the dental setting, and each of those interactions produces the possibility of a transmission of infection from one person to another. So we shouldn't just think about the practitioner infecting a patient or a patient infecting a practitioner. We should also think about one patient being able to infect another patient somehow. How would that happen? We'll talk about that. How dental staff can transmit infection to another dental staff member, or vice versa. So commit this definition to memory, memorize it. And these are the guidelines, the Australian Dental Association's guidelines. They have produced a very nice, concise, and specific to dental practice setting guidelines for infection control. And these are one of the documents, this is one of the documents that will be used to determine what is appropriate practice in a dental care setting. There are other guidelines which we'll talk about in the online lesson. Other documents which will give us guidance about what needs to be done, what precautions need to be taken and how to do that. And of course there are other laws and regulations as well that govern the way we should do these sorts of things. But I just want to draw your attention to an extract from this document. And it says that in order to be successful in controlling or preventing infection, there are 4 important things to get a handle on, for you to get a handle on. The first thing is to understand how infections are actually transmitted. So you need to understand the basic principles of infection and therefore how to control it. Okay, so you'll be learning things in this subject, but in more detail in other subjects which look at infections. So you'll get a sense of the virulence, the type of organism, the way they can be spread, and how they then infect another person. So that basic understanding of infection and the way it's controlled is fundamental to our safe practice. We also need to understand what sort of systems can we put in place, procedures that are systematic, that we can put in place as practitioners that will reduce the risk of infection. We also have an obligation to stay up to date regarding specific infections, because there are new infections or evolving infections that come along that take us by surprise. So for example, bird flu, SARS, those sorts of infections will emerge in the future. So we need to keep abreast of those infections and ensure that our infection control and prevention procedures are managing those as well. And the last thing to do is to identify settings where you might need to do things a little bit differently. So if you're moving outside the dental surgery, where it's quite easy to control infection or prevent infection, but we're moving into non-traditional settings like nursing homes, schools, other areas, those environments aren't set up as well as dental surgeries are for the prevention of infection. So for us, if we want to actually work in those environments, we need to have the skills to modify our infection control procedures to ensure that we are keeping our patients safe regardless of where we provide the dental care. Now, there are multiple ways in which infections, microorganisms, can be transmitted from one person to another. They can be transmitted via aerosols, so someone can snort or cough or sneeze infectious agents from the respiratory tract into the air. So they will float around and can come into contact with other people, sometimes via a surface, or it may occur directly from one person to another. So we need to be aware that saliva is a vector or vehicle for infection. And as oral health professionals, we are working pretty much every day with saliva. So controlling saliva, controlling its aerosol, is important for us. Infections can also be transmitted via a puncture wound, so they can find their way into our bloodstream or into our tissues by a direct puncture wound. And in dentistry, we are working with sharp instruments, and some people have already injured themselves in the first week of our preclinical program with a sharp probe, for example. So infections can be transmitted or spread directly into bloodstreams or into tissues through puncture wounds. They can also be transmitted via food, and this is less of an issue in the dental care setting, unless of course you're eating in a clinical care setting, and I've seen that before actually. It's not very nice, but more generally, microorganisms can settle on food. Food is kept inappropriately in a warm condition where bacteria can multiply. Bacteria can multiply very rapidly in some situations and then be ingested by someone. So we see a lot of gastrointestinal infections being transmitted via food. So in the food preparation process where people don't wash their hands. I'm a little bit obsessed with hand washing, but it always surprises me when I watch food handlers, people preparing my food in restaurants or other places, how much contact their hands and other parts of their body have with my food. And I just hope that they're engaging in effective hand cleaning behaviours. And the other way of transmitting infections is through surface contact. So, you know, the aerosols, but also things like splatter from blood, splatter from saliva, splatter from feces, those sorts of things. Splatter onto surfaces can sit there. Blood, for example, can sit on a surface, and if it's not dried out too quickly, it can actually microorganisms can remain viable in that area. And then if someone touches that surface, then the infection, if they have an open wound, for example, or in some infections they don't even require an open wound, it's just contact, that can also spread infection. So there are multiple ways in which bacteria can be, not just bacteria, but microorganisms can be transmitted from one person to another. Sometimes it's directly, sometimes it's indirectly through surfaces. So you should be starting to think now about the dental care setting, and all of those modes of transmission, there is a possibility of it occurring. And that brings us to the chain of infection. So this, remember, was associated with one of our intended learning outcomes.